Dr. Yoni Whitten here. Almost every single day, I receive questions from people that are suffering with arthritis, autoimmune conditions, and general inflammation, and they all want to know the same thing. What can I do to help myself and eliminate my pain? This week, I got to sit down with functional medicine practitioner Dr. John Dempster, and we go over what's causing the rampant increase in these types of conditions, as well as some simple strategies that you can use to eliminate your pain. I really hope that you enjoy this interview. Let's get into this. Welcome, everyone. Today, we're joined by Dr. John Dempster. He's a board-certified naturopathic doctor and a functional medicine practitioner. He's also the founder of the Dempster Clinic in Ontario, Canada. Thank you so much for being here, Dr. Dempster.
Thanks, Yoni. Thanks for having me.
Yeah, my pleasure. What I wanted to start off with is your background. I just want to talk a little bit about how you got into medicine and where that all started.
Well, you know what? I was actually heading into traditional medicine. That's where I didn't have too many options where I grew up. I grew up in a small town just north of Toronto. And I came from a very, quote unquote, normal family. And we, took our medicine when we needed to. But we always had this theme of nutrition and just being a little bit more health minded. But it really accelerated when I lost two uncles in 1 year. So each of my parents lost a brother within a year of each other due to chronic illness that they were dealing with for a long time. But I was at the age of about 13 when it happened, and it really gave me some pause to say, okay, they were taking their medicines and they were doing this and they were doing that. How come they didn't get well? And of course, my parents didn't have any immediate concrete answers they could provide me. This was just what happened sometimes. And, but it really gave our family a jolt. And I just remember my parents having us, giving us the carrot juice before dinner and the fish oil before breakfast. And, that sort of thing was like, obviously we rebelled as kids, but, over time going into my high school years, I remember thinking, wow, like my parents are doing really well. And, my siblings and I, we don't get sick, and, we're excelling in sports and we're excelling in academics, and there's lots of factors for that. But I just remember thinking, hey, maybe there's some method to this madness that we had to deal with. And then that really piqued my interest going into my later high school years and then into university. When I was doing my pre-med, I knew I wanted to be a doctor, but I still didn't know about naturopathic medicine. It wasn't even a word that was described in our town of an offering that we could have. And I just knew that I was interested in clinical nutrition. And so as I was beginning to apply to post-med schools and so forth, it came across that this was, wow, you guys offer nutritional medicine every day in your curriculum. As I'm talking to the traditional medical schools, it's like the answer I'd be given was that, oh yeah, you'll get 3 hours. I was like, what, 3 hours a week, 3 hours a month? What is that? No, you'll get 3 hours. Wow. I was like, oh, okay, so that's interesting. And so naturally, to make a long story short, that drew me into naturopathic medicine. And then during my naturopathic career, I was still, again, really fascinated by science and technology and bridging that with natural therapies. And that's where functional medicine became a journey of mine as well. And I became board certified in that. And here we are opening, a functional medicine clinic many years later, and talking to you and doing lots of interviews like this.
That's awesome. Well, it's funny, John, because a lot of practitioners that are outside of conventional medicine have stories similar to yours. I know in my family, we have a very similar story. My grandmother was diagnosed with cancer. She was given 6 months to live. And they said, you need to start chemo and radiation, get your affairs in order because you don't have very long. And she basically gave them the middle finger. She did not feel that they were able to dictate terms to her. And she did no radiation. She did no chemotherapy. This is the early 1980s, so well before the internet. She sought out a small clinic in Tijuana, which you've probably heard of, called the Gerson Clinic.
Definitely.
So I have memories of going down to visit my grandmother in Tijuana as a little kid. I remember what the Gerson Clinic smells like. I remember the juicing. I remember the beach. I remember everything about it. But like you, long story short, she completely resolved her cancer situation.
Wow.
Went on to live for many years longer. And so that, like you, created kind of cracks in the foundation and that big question mark in your head of, well, maybe there are alternatives. Maybe conventional medicine is not able to dictate for every single person when they're going to live and when they're going to die.
Yeah, and I remember Max Gerson's story, and obviously his wife, after he passed, carried that tradition on. But they're still around, and they have helped so many patients dealing with cancer and many other chronic conditions. So, my big philosophy at my clinic, Yoni, is that I'm very pro-integrative. There is a role for Western medicine, there is a role for naturopathic, there is a role for chiropractic, and we all, I think, really what I'm seeing, what I'm really encouraged about in the healthcare system right now is this integrative approach that's slowly coming together. Many of my colleagues in my functional medicine training were medical docs, and we would all get together and we'd have great powwows and great synergies. And really, I think as we continue that embrace, that's where the patient is going to have the best options available to them, because there's crisis care that are things that you and I can't manage. And then there's things that chronic care that we're probably doing, some really good things for our patients that should be considered as part of a total care. So I'm really of that belief of the integration right now. And I'm excited for what healthcare is going to bring.
That's extremely well said. And I love the patient-centered approach. There's a time and a place where conventional medicine is the best thing. If somebody gets hit by a bus, that's absolutely where they need to be. For chronic degenerative conditions, like we're going to be talking about today, that are killing the majority of people in Western society, Western medicine has proven over the years that they're not the number one source for something like that. But you're right, there's a time and a place, and everybody's situation is different. And I think the start of that integrative care is understanding what each practitioner brings to the table so that everybody knows who's the most appropriate for that given situation.
Absolutely. That's the way it's probably heading that direction slowly but surely. And I don't know what it's like near you, but I'm seeing glimmers of this, which is great. But you've got to put the patient first. And I know you do that in your practice. That's what we do. And we really do a very patient-centered workup with each patient. And I know we're going to talk a lot about autoimmunity today and a few other things, but that is such a broad topic. And maybe, I'll let you take the floor. I'm not going to steal your thunder, Yoni. You get in there. You fire away.
Well, no, so it's funny because on the subject of integration, we are seeing it, because I have quite a few patients at this point, John, who are medical doctors or retired medical doctors who were explicitly taught during their time in medical school, never refer to a chiropractor and definitely never see one yourself. Now they've gone through everything that the approach that they worked in for 30 or 40 years had to offer them. They're scientifically minded, so they can see, hey, this didn't pan out. Maybe I can try something else. And so, yeah, I'm seeing it as well. And I agree with you 100%. It's a very exciting time to be a clinician. But also getting back to what we were just talking about a second ago, with that integration, there's this importance of understanding what each specialization or umbrella of medicine brings to the table. So naturopathy is not super common in the United States. And so maybe you could just start there, John, and tell us a little bit about what is the overarching philosophy of naturopathy, and maybe how does it differ from conventional medicine?
I think it really differs right off the bat, that, again, to use this term we've discussed, it's very patient-centered, and it's about establishing a root cause resolution to the best of our ability. Everyone is unique in the sense I could have 10, call it rheumatoid arthritis patients in front of me. They could all be sitting in my office. They could all walk out of here with 10 very different treatment plans. Because as we start to get to know that individual, we may start to uncover certain biochemical imbalances or different dietary tolerances and intolerances. We may identify different ways that they handle stress in their life, different environmental factors. What we're really trying to do is peel the layers back to get down to the underlying blind spots, I call them, or imbalances and triggers. One of my favorite sayings by a very well-known doc in the functional medicine space was, look, if you step on a thumbtack, it doesn't matter how many Tylenol you pop, you still need to pull the thumbtack out for optimal healing to happen. You may be pain-free, but that thumbtack's still on your foot. And so, what I always think of this is that, look, I'm just looking for these little proverbial thumbtacks that might not be so obvious. And we're using natural therapy. So that obviously has a lot to do with food and nutrition, but it could have involved supplements and botanicals as well. It could involve lifestyle changes. In our clinic, we do a lot of intravenous vitamin infusions and vitamin injections as well. We do a lot of detoxification strategies. So there's a lot of different cornerstones to somebody's healthcare plan that we look at. And really we started, and the tenet is, really begin at the root of the issues and work your way up from there. So I try to get right down as deep as I can from the get-go. And that really is how I harness functional medicine. So the two are very similar, and I don't want this to be confusing to anyone listening. Functional medicine is built upon naturopathic philosophies. It's treat the person first, do no harm, and look at the root cause. Mm-hmm. And so we're constantly trying to figure out, okay, if we have somebody in front of us that has a chronic illness, it's not that we have any magic cures that they haven't heard of, but sometimes taking a systems-oriented approach and pulling those thumbtacks out along the way really allows your body to start to heal. And it's amazing what happens if we get out of our own way and we clear the road and remove some of these obstacles. Our bodies are smart, they are strong, they're robust, but you have to give them the chance to do the healing. And if we don't do that, we're just going to be doing the Band-Aid approach and the palliation approach. And, I think we've seen a lot of that over the years.
Yes. Yeah. And it hasn't worked out super well.
Not for many at all.
Well, it's interesting that the underlying philosophy of so many, I don't want to say alternative, for so many ways of approaching patients that are outside of conventional medicine seems to be centered around this idea that the body is intelligent, that it's self-healing and self-regulating. And if we can remove various interferences to that, whether that be lifestyle medicine or dietary problems or toxicity in the food or the environment or whatnot, the body has this remarkable capacity to it knows what it needs to do and it'll do it, as you said, if we just kind of get out of the way.
Totally. Yeah. And another big one that I didn't mention, and I'm staring at you, and I can't believe I didn't mention this, is obviously, our musculoskeletal pathways and connections need to be intact as well. So, we look at the anatomy as well. And all of these things need to be really, really balanced. And that's not meant to sound overwhelming. I think one of the biggest things that I've learned over the years is that, it's exciting to talk about all these things and to share our knowledge with patients, but we have to realize that sometimes this is all new to them, and it just can be very overwhelming, especially if it's like a first appointment or first time dipping their toes into this. So we have to always meet our patients where they're at, and that's why I love about this type of medicine is we can go at any speed. Mm-hmm. And again, taking that patient-centered approach, you've got to meet them where they're at, because I could lay out the best treatment plan possible, but if they don't follow that treatment plan, that person's not getting well. So sometimes we do have to just put one small foot in front of the next and just get a little bit of momentum and start to let things come together at that point.
Yeah, very, very well said. And I can definitely relate to that. It's a bit of an uphill battle, especially in Western society, where here, especially in the US, we have direct to consumer advertising for pharmaceuticals. And so our society is fairly well conditioned that if there's a symptom, you're supposed to be taking a pill for it. And which pill goes with which symptom, that idea is heavily ingrained in people's heads. So coming at it with an approach like yours or mine, it is a bit of an uphill battle in helping the patients to understand that what they're doing is contributing to the results that they're getting. And so, but it's meant to be encouraging, as you're saying, rather than overwhelming, so that we can also say, hey, that means that you have control over this situation. And if we change some of the things that you're doing, you will change the results that you're getting. So I totally relate to what you're saying as far as making it into an empowering message rather than an overwhelming message.
We link arms with our patients. We really try to allow them to become advocates for their own health. And, and again, we're here as almost coaches for them to help steer the ship in a way. But, everyone's got their own journey, and some people are willing to make drastic changes to their diet. They realize that their body might be very sensitive to gluten, and they'll make those changes. Some people aren't quite ready yet. Some people are like, no, you're not taking away my pizza. And we do have conversations, and sometimes those are types of patients that we would say, look, you might be a better fit somewhere else. And it's not to say that we don't have patients for entry-level patients, if you will, but we have to see change happen in order to see change occur. And if we don't make any different steps, we're not going to get any different outcomes.
Absolutely. Well, we know the definition of insanity.
Definitely.
So one of the main things that I wanted to talk to you about today, John, and I'd love for you to address, is I do several live webinar events every single year that relate to the main causes of chronic pain conditions. And there's a live Q&A session at the end of every one of those live events. And inevitably, there will be multiple people who ask the same question at every single event. And that is, I have psoriatic arthritis, or I have rheumatoid arthritis, or I have some other fill in the blank autoimmune condition, and I have severe joint pain throughout my body, which, as you know, is one of the most common manifestations of those types of conditions. And my program, the Pain Fix Protocol, is not designed to tackle pain conditions that are stemming from autoimmune. It's designed to deal with the most common chronic pain conditions, and those are far from the most common. I think the incidence of rheumatoid arthritis worldwide is like 1% of the population. So it's not a super common condition. But there are some scary trends that are happening right now. For example, the incidence of rheumatoid arthritis from 1990 through 2017 went up nearly 7.5% worldwide. And that's kind of playing out with different autoimmune conditions across the board. So there's a lot of questions packed into this, but what I'd like you to start with, if you would, is what is at the root of these autoimmune conditions, and why do you think that their incidence is increasing?
Well, I'm glad you asked, because we take a large part of our practice is focused on autoimmunity. And we've seen a huge amount of increase in this over the years. I've been in practice for 15 years. That doesn't mean it hasn't been around prior to that. It's just, I think, we're becoming more and more aware of these things too with the information generation. But why do I think autoimmunity is on the rise? And again, you've mentioned two of probably over 200 different diagnosable autoimmune conditions that are available out there right now that we know. And I almost always see it as a collection of what I call a perfect storm. It's never usually one thing, although it may be triggered by one moment, one event, or one situation. That may be the tipping point. But when we start to do the work, we're finding that there's imbalances in numerous systems in their body. And so this is where I think that we're struggling with this, in the traditional sense of the approach to autoimmune disease, if you will, is that, we can't just look at each organ as an isolated organ. We have to look at the whole system, and they're often connected by multiple systems. So with autoimmunity, we find that multiple systems are out of balance. So if we're talking about, let's say, rheumatoid arthritis again, yeah, I'm going to be looking at the MSK and I'm going to be looking at the joints. But to get to that level of inflammation, there's been a lot of things that we often see that have been occurring over the years. There may have been some, and a huge focus of mine begins in the gut, especially with any autoimmunity. Over 80% of our immune system lives in the gut. Mm-hmm. And this is a tremendous amount of usually, I would say, starting ground for us to do a workup with someone, because, depending on what they're dealing with, there's often always some action in there that we need to take. Whether that has to do with correcting bacterial overgrowth or correcting yeast imbalances and fungal overgrowth, possibly parasitic infections, including, ova and protozoans or worms. There could be a situation called leaky gut, called intestinal permeability, medically speaking, where we are now getting better and better at diagnosing this through different biomarkers. And all of these things can really just start to fan the flames of the word inflammation. And again, a common thread to a lot of autoimmunity, whether it's pain-induced conditions or something different like potentially, Hashimoto's hypothyroid, it's all inflammatory triggered. And we now need to just peel those layers back and start to figure out, okay, now the gut to me is the foundation of this. We've got to begin there. We've got to heal and seal the gut and start to work our way out. Are they eating foods that their body's immune system is creating an immune response to, which is then secreting a number of different biochemical compounds, such as cytokines and leukotrienes, for example, that are pain-inducing in the body? Do we have leaky gut that's allowing partially digested foods or microbes and different toxins allowed to get back into circulation that we've worked so hard to get out of circulation and keep out? But now, because of the medications they've been on, or because of the stressors they've been through, or because of the genetic modified foods they've been eating, or the compounds they've been exposed to at work, their intestinal cells, called their enterocytes, are starting to separate. And those bridges that have been keeping them together are disintegrating. And there's ways that we can measure this. And if we don't have that part intact, you're literally building, a house on quicksand, if you will. And that's just the start of what we start to do with our patients, is we take a good hard look. in what's going on in different compartments in the gut. We also talk about something called SIBO, which stands for small intestinal bacterial overgrowth. And as it sounds, that has a lot to do with the small intestine. And that can also be a big factor for subtle inflammatory triggers throughout the rest of the body. But it's very hard to detect that through standard X-rays or colonoscopies or CT scans. It can only be done really accurately through a proper breath test. And so these are some of the tools that we start to embrace in our clinic and utilize. We find a lot of our autoimmune patients are not only dealing with one nutrient deficiency, they're dealing with multiple nutrient deficiencies. So we actually will measure a plethora of nutrients, upwards of 34 to 35 nutrients in one panel, to try and understand where their deficiencies are. And we're not just looking at the last 24 hours, which usually what a standard blood draw will provide us for some of these nutrient markers. We're looking at tests that can give us information from the last 3 to 6 months. Wow. And that can give us a much stronger baseline as to what this person is really truly deficient in, as opposed to what's going up and down depending on what they ate or didn't eat or supplemented with. So these are just some of the starting conversations we have with our patients. We also spend a huge amount of time talking about toxicity. And I do see that as something that's been on the rise, through a number of decades in developed nations, especially. But we've got to start looking at the impact that this is having, and it's not just about the typical, smoggy buses that are, chugging out the big diesel fumes. There can be off-gassing in your office through, some of the materials in your office, in your workplace, at home. Compounds you put on your body with personal hygiene products, and even dry cleaning. We've got to be careful with. And that's not to overwhelm people. Once again, that's just to inform you that there are things that you can start to take stock, and we can almost do an audit to find out what's going on with somebody. And that's why we leverage the power of testing in our clinic so that we can reduce the guesswork. I like to say, when we test, we don't guess. And that can really help us get the biochemistry sorted to each person that walks in. So that's just a snapshot of what we do. There are other things that we look at case by case. But those are some real key pillars that we get going right away.
Wow, you mentioned a lot there, John. I want to kind of tease a few parts of that out. So let me phrase it a little bit differently. If John Dempster was writing a textbook and he had to define his textbook autoimmune patient, I know I'm putting you up against the wall because this patient doesn't exist, but what are the commonalities between these people? Do they all have dietary problems? I'm saying all, I know it's not fair, but do the majority of them have dietary sufficiency, or do they have dietary deficiency? What type of toxicities exactly are they coming in with regularity? You mentioned a bunch there, which are heavy hitters, and like you mentioned, a lot of people are not even aware that they're happening. So they're kind of bioaccumulating these little amounts of poison day in and day out. And then over the course of decades, it can make a significant impact on a person's health. So what types of things are you really seeing with these people? And then what manifestations are you seeing in the body?
So it's almost, I like what you just said there, it's almost like death by a thousand cuts. These things do stack up, and we are seeing themes though of some big areas. And I have yet to see somebody who's not having an issue with different degrees of food that's going into their system.
Okay.
And there's some commonalities amongst that, and these are not going to be surprising to hear, but we see a ton of people reactive to gluten.
Okay.
And this is something that is obviously, not news to anyone listening right now, but the science is still growing in this. And I've had the opportunity to work with some of the most researched and best doctors in this space. And we're seeing that the research is continuing to be very glaringly evident that if you have an autoimmune condition and you're continuing to consume gluten, you're going to have a very tough time really creating a true healing environment in the body. And gluten goes far beyond some of the traditional testing that's available. We embrace some of this testing as looking at a lot of different foods, such as different antibody testing. Looking at IgG, IgA, and IgM tests are available through blood work, and we will throw a net really wide, often 300 to 400 different types of foods. But gluten is a very particular one, and it's very tough to always nail that one down just through the standard antibody testing. So we have to really take some consideration in the fact that virtually almost anyone that is dealing with a suspected or confirmed autoimmune case, we put them on a gluten-free diet, and in some situations, we put them on a grain-free diet.
Okay.
Because gluten is interesting. There's about 4 or 5 different markers that we can successfully measure.
Mhm.
But what we're seeing in the research is that there seems to be over at least 100 of what we call coding proteins for gluten that just aren't easily accessible to get tested. And so that means is that there's 96 other ways that gluten can get us, or more.
Wow.
It seems to be more emerging in research right now. But if we can only measure 4 of those 100, that's not really going to give us the full picture, even though it often will give us some insights, those 4 alone. We have to start looking at, okay, now we're seeing a real glaring evidence here that gluten can hit us on many different levels.
I see.
So that may not be surprising to hear, but it is an important one to reinforce. And sometimes we have to, coach our patients through this. But yes, there's a reason why we're talking about this. This is not a trendy buzzword.
Yeah.
This is literally based on science.
Well, so that's an interesting thing. Let me just jump in before you go any further, because I want you to go to the ground floor on gluten, because everybody knows the word nowadays. But Can you just tell us what gluten is? Because I don't think most people know.
It's in all the good stuff, Yoni. No, I'm joking. No, and then that's the honest truth is that's what people think. They think, oh my gosh, I'm not going to be able to eat anything that tastes good anymore. Now, luckily, we are in a time where we do have lots of options. But it is classically found in a number of the main grains we consume regularly: barley, rye, wheat, and spelt. It technically can be in oats, but there are a lot of gluten-free oats that are available on the market right now that you can find. But as I mentioned, those are the ones that are actually, the real typical tip of the iceberg gluten players. Gluten receptors in our body can be activated by virtually any grain right now, including some of the gluten-free grains. So one of the biggest misnomers in health care right now is that, okay, if I buy a product that says gluten-free on it, that's healthy. Well, that could actually make somebody even sicker, because what happens it's not in every gluten-free product, but a lot of them traditionally, they're filled with corn and they're filled with sugar, corn derivatives and sugar. And that's because, traditionally a lot of those flours just didn't taste as good as the traditional gluten flours. So we've got to be very careful about being, victim to some of the marketing that's out there.
Yes.
And learning how to read labels is an important thing. We work with nutritionists in my practice to help our patients shop properly and therefore prepare their food without, question or concern of, is this okay? Is that okay? And so it's really, those are the big grains that we usually start with to help our patients to cut out, and then we build upon that.
Okay. So we have in the Dempster textbook, we have autoimmune patients coming in, and many of them have sensitivity or problems with grains of various types stemming from gluten. And what else? What other types of problems are they coming in with?
Well, I don't want to pinpoint just gluten as the only food. Almost all my autoimmune patients have multiple food reactions.
Sure.
Gluten is just one that we boom without even seeing a lab test. This is the first thing that we're teaching our patients to do, is to eat a gluten-free diet.
Okay, so what are some of the other very common ones?
So we see a lot of activity with a lot of the nuts and legumes and beans. And it's interesting because we're starting to see some correlations in some of the studies right now that people who are highly reactive to grains are also having some molecular mimicry and some cross-reactivity to a lot of the legumes. Mm-hmm. And so when we do have the opportunity to measure these through antibody testing, we do see a lot of legumes and nuts and peas and so forth coming out. And that's not to demonize them, but that is just, again, something to be careful of. Also, we see a lot of reactivity to nightshade vegetables, and nightshade vegetables are not always testable through antibody testing accurately enough to say, hey, we still got to focus on these, because they contain compounds that are very pro-inflammatory, specifically to those who are more prone to musculoskeletal pain. Mm-hmm. And so those are things that we see some trends with as well. But beyond that, you name the food, I've probably seen somebody react to it. It's just always, that's why we have to take that patient-centered approach. And books are wonderful, and programs, I have programs that I put patients through. They're wonderful, and they're a great starting point, but sometimes they're not the end of the discussion. And sometimes we just need that personal touch.
Yeah, absolutely. Yeah. It's very good to have those types of programs in place, because you can kind of get somebody started with the basics, and they Definitely. Can, kind of dig themselves out of a hole to some degree and get themselves at least back to ground zero before you start kind of painting your masterpiece, so to speak. But one of the other things that I'd like you to talk about, so they're coming in with problems with various foods. Do you address at all differences between conventional and organic produce, or big factory farmed meat versus pastured,
Yeah.
grass-fed meat.
Oh, definitely. So this brings in, our whole discussion about toxicity and foreign substances to the body, which we spend a lot of time with our patients. And when we can, we identify what's going on in their specific body. But we also talk about, hey, listen, if you're breathing on this planet right now, you're toxic. We just have to find out, okay, what can we do to reduce that level in your body? It's not about making this perfect. You're not going to go live in a bubble. But we can actually start to make some very powerful decisions with our day-to-day decisions. So organic is a very important conversation. It again is another one of those things that I think was buzzworded quite heavily, but the science is there. If we can eat foods that have higher nutrient counts and less toxic compounds that are stripping our body of nutrients and creating more inflammation, that is a no-brainer. And sure, it can cost more. Luckily, it's getting less and less cost prohibitive to enter into that space. And you don't have to be perfect with this. You don't have to be perfect with buying everything organic. To me, there's a balance out there, Yoni, and you probably see this. Sometimes if somebody's so focused on doing everything right, they get so stressed out, and that creates more problems than it's worth. And so we try to create some sense of balance out there. That look, we have a list of foods that if you can really try to buy these ones organic as much as possible, great. If you are going to eat animal products, that's fine. I'm neither pro or against. Well, actually, I am more pro about animal products in many situations. It's just the way that they've been raised that's the problem. It's the way that they've been slaughtered, and that's the problem. It's the way we've cooked the meat is the problem. Mm-hmm. So there's again some education around grass-fed beef versus organic, typical grain-fed beef, which is very often pro-inflammatory. But the grain-fed beef is the stuff we see on the grocery shelves largely.
Yes.
And why do we feed our cows corn? Well, it's cheap. The cows love it, and it fattens them up for slaughter, so we get a better yield when we sell the beef. So, that doesn't mean it's good for us. And so we have to take a step back, and if we're going to make these decisions for ourselves and for our families, it is going to make sometimes a bit more effort to find these foods out there. But again, we're in such a great time right now where there's lots of things you can order online that can come right to your door. There's companies that I'm sure you have out there that we have in Toronto that literally can bring grass-fed beef right to your door, pasture-raised chickens, and fresh eggs right to your door, organic veggie bins and fruit bins. I'm finding less and less ways to accept excuses on this right now when people come in and say I can't do it.
Well, that's extremely well said. This is the best time to be doing it. When I was a little kid, we used to have to drive out to farms to get organic produce, and it was a huge effort. There was one health food store in all of San Diego, which is a major metropolitan area. Now we've got health food stores everywhere. The awareness is just through the roof. And as you're saying, there's these co-ops where they deliver fresh, local, seasonal vegetables directly to your door. I agree with you. That was extremely well said. But it's also then very concerning where we're seeing trends like the paper that was presented by the National Institutes of Health, where they published the results of a study that had over 14,000 participants ages 12 and up. And they were looking at ANA, which for the people listening is anti-nuclear antibodies, which is the most common biomarker in the body for autoimmune problems. And they're finding that the overall incidence in the period of time from 1990 to 2012 was over a 30% increase. Now, that's not the scariest part. The scariest part was that in young people, 12 to 19, the increase was threefold.
Wow. Yeah, so it's not surprising.
This is like, it's like you can't fathom what's going on here because we have this huge increase in awareness. Like we have Costco, which is this major, you guys have Costco up in Canada. So
absolutely.
The Costco now carries tons of organics, which all comes back to consumer demand. They carry bison, they carry all these great things, but it's all based on people saying, hey, Costco, we want you to carry this stuff. We're willing to pay for it. But at the same time, we have this massive increase in autoimmune biomarkers in the body. And even the NIH is saying, look, this wasn't enough time for there to be genetic changes, which means it's most likely either lifestyle or environmentally related.
Yeah. So, again, we have to address these things bit by bit. We have to peel those layers back bit by bit, and I think we're more woke now about the potential of, harm coming from genetically modified organisms. It's not to say that maybe there's not a role to play somewhere in the world, but I really truly think that this is a big concern. Things that contain glyphosate.
Mhm.
We're seeing that this is ubiquitous in our environment and in our air right now. It's not just on foodstuffs anymore. It's actually throughout our water supply and beyond. And these
Go
are
ahead and just explain what glyphosate is, John, so that everybody's on the same page.
So glyphosate is a compound. It's in Roundup, and it's helpful for the farmers. Seemingly back then to keep it's a pesticide and a herbicide, and so unfortunately there's been a lot of controversy about this. And again, I'm not here to point fingers at any one company, but that seems to be a big problem, that compound. And it's something that if we can reduce that we're seeing it in umbilical cords right now in babies, along with hundreds of other toxins that weren't there, 50 to 100 years ago.
And these are in newborn babies, to clarify.
These are in newborns, and these are studies coming out from one that I'm citing right now. It came from the Canadian government, and it's cited that over 200, they found that on average, they're finding 220 chemical compounds in umbilical cords, newborns, of course. So this is like, wow.
Yeah.
So it's not just affecting, those of us who are able to make choices, affecting those that are along for the ride initially, and those are the ones that we need to be looking out for the most.
Well said.
So,
and the scary thing about that is that the placenta was designed to filter those poisons before they get to the infant, but because these poisons are so quote unquote new, as far as when they've been introduced to our species, we haven't had enough time to build up defenses to them. So essentially they're being passed through to unborn babies unfiltered. Is that fair to say?
And that's fair to say, but guess what? Those are only the chemicals that we know we can measure.
Wow.
Right now, we're only measuring, I think we only have the capacity to measure, I think somewhere, and it sounds like a lot, but we got about 2,000 to 2,200 chemicals I think we can measure for. Mm-hmm. There are over 20,000 known chemical compounds that are apparently being used in our foodstuffs, in our industries, and so forth. So we're only measuring the impact of a fraction of these right now. And wow. Again, that's not for us to all go and run and hide, but it's to take action and to reduce things that we have the capacity and the ability to reduce, as opposed to throwing our hands up in the air and saying, oh, there's nothing I can do, I'm doomed. I don't believe that for a second. We are, again, resilient. We do have the ability to repair and heal, but sometimes we just need to lower that burden. One of my biggest analogies, this goes back to your discussion about our notion of toxicity, is that, I show everyone this mug when they come in, and we don't want this mug ever to overflow. We always want it to oscillate and keep, it's managing the levels of water in my mug. If it overflows on my desk, we have a problem. So what's the analogy? The analogy is that our body is constantly trying to deal with the ebb and flow of toxicity that's in our body, that's coming through our environment, our foods, but also being produced by the bacteria and microbes in our body. Mm-hmm. And so if we are not dealing or have the capacity to deal with these onslaughts, then eventually that starts to overflow. And that's when we get ill. And that's when illness presents itself. It's not that this just happened because, we had food poisoning and suddenly everything's gone awry. It's that was the final drop that tipped over, and spilled the mess on the desk. Mm-hmm. So we've got to start to go back and say, okay, how can we reduce that level? Mm-hmm. And it doesn't have to go down to zero. Just as long as we've got a buffering room in there, oftentimes that's when the healing can take place. Yeah. So that makes a lot of sense to my patients, because then they realize, okay, cool. So I don't have to be perfect? No, you don't. Yeah, you're going to want to be really at the onset. You want to get the momentum going right away, and you really want to be as strict as you can initially. But it's kind of like pushing that ball, a giant boulder over the hill. As soon as you crest the hill, you can take your hands off a little bit.
Yeah.
And then we can, then we can start to pick and choose our battles a bit better.
Yeah. So you're talking about there, broadly speaking, the concept of allopathic load, where various stressors all end up kind of in the same bucket, if you will, within the same body, within that person's body. And any area where you can remove some stress can be helpful in dropping the level of the cumulative stress below that threshold level where it's no longer spilling over, like you said.
That's right. And, specifically, I was pointing to toxins as part of the allostatic load, but there's obviously other aspects that contribute to that.
Absolutely.
Emotional stressors are a big one.
Huge.
And again, you talk about common threads that I'm seeing in my autoimmune patients. Yes. There's often a lot of trauma, not necessarily like the trauma we envision, but there can be micro traumas that have happened over time. There's usually some major stressor event that's happened emotionally. Sure. To a lot of these patients at some point in time as well. And, I think most of us have probably been through some major event, but some of us, that really triggers us, and some of us we can actually recover from.
Well,
why is that?
How about the last year that everybody's been going through with tremendous social isolation and fear and it seems like all the news is bad news, at certain times nowadays. And on top of that, we have a social species that's being kept in isolation, which in and of itself is an extreme stressor.
It's a massive factor. This year has been a pressure cooker.
Yes.
And I've never seen more people that I thought were, had a pretty good, hold on things you see the cracks in the manifold there pretty easily this year.
Mm-hmm.
So, we all have our breaking points. So if we can constantly work at keeping our body in some state of balance, that's really going to help us navigate any other unforeseeable events that happen. Like this one came out of nowhere, of course, well, arguably, I'm sure some people would say that, oh, they saw this coming, but most of us, this is like, well, where did this come from? And,
sure.
and it's disrupted the way of life that we know. And that is something that, whether we think that we have stress or not, that subconsciously is playing with us, because we've never, ever in our lifetime had to deal with something like this.
Yeah. One other thing that you mentioned, John, is leaky gut, which, like gluten, is a term that I think a lot of people have heard, but I don't think they know exactly what it means. Can you explain that term, please?
Sure. So we have cells in our gut that are called enterocytes, and they're much like a brick wall of a home. They're really tightly bound together. Now, they do have a very, very small channel that goes in between each of these cells. So if you can kind of imagine your brick wall without the grouting, that's kind of like what we're dealing with. Okay. But that's going to be very selective to let nutrients through. And those are the things that we want to come through our intestines, get extracted from our foods, and get into the bloodstream so that it's distributed to our tissues to do what nutrients are supposed to do. Mm-hmm. But what happens if somebody takes a sledgehammer to that brick wall of your home and starts to knock out a few bricks? Well, we suddenly got bigger holes, and we've got, a bit of a mess to deal with, specifically if you're trying to keep insects out of your home, or where I'm from, you're trying to keep snow out of your house, all these things. We suddenly have a very non-selective membrane at that point, and things are going to get in at their discretion. They're just going to walk right in. And so if we can start to identify if somebody has these leaks in their membrane, so we really want to keep those tight junctions, which are literally the gaps between your two gut cells together. If we can keep those tight and not let them start to leak apart so that things are sleeping in and sneaking in there rather, then we're going to do a lot better, and we're going to keep a lot of the inflammatory compounds out of circulation, so which is going to just add more fuel to the fire. If they're ripping around our bloodstream, different infectious molecules or toxins and so forth, that is only going to make it harder for us to heal and recover. If we can remove that, and by healing and sealing initially, and then starting to remove that debris from our body, that's when suddenly you're like, okay, phew, I don't have to worry about, dealing with all this. It's like you're trying to fend off people with one hand and try to eat your sandwich with, the other one. It's just very hard to do. You'd rather focus on one task at a time. So that might be a funny way of describing it, but that's really what it comes down to, is keeping these tight junctions together. I remember I gave this talk once. I was in a group of about 500 people, and I was talking about leaky gut. This was about maybe 10 or 12 years ago. And I had somebody stand and said, "Doctor, I think I would know if I had a leaky gut." And he's like, most of us think of stuff leaking out of our rectum. That's not what it is. It's more internal. It's invisible. You can't see this. Mm-hmm. But we are now able to measure biomarkers. There's a biomarker called zonulin that you can run, that if it's elevated in your stool or in your blood, that gives you a sense if we're starting to see that, see some semblance of leaky gut happening, even though it might not be visible to you. You don't have to always have digestive issues to have leaky gut. Mm-hmm. And this is where this whole concept of autoimmunity, we have to really start looking into other areas that might not be reflective upon, joint pain and so forth. So we've got to take that step back and look at really rule out leaky gut with a lot of patients right now.
Very interesting. In the example that you just gave with the brick wall and the sludge hammer that's hitting it to knock open the bigger holes, what are some of the most common sludge hammers that you're seeing with these people?
Gluten.
Okay.
Different pharmaceuticals, antibiotics.
So actually medication, drugs that people are taking.
Oftentimes they can be, again, you've got to discuss this with your doctor, but sometimes they can be causing these problems behind the scenes, and you've got to be aware of that.
Okay, so we have gluten and drugs, and what else do we have that are the most common?
Well, we've got toxins such as heavy metals we haven't really touched on today, but things like mercury and lead and aluminum and arsenic and cadmium. things that are found again in our environment rather ubiquitously, we can measure for and remove them if they're in there. But different types of environmental toxins such as heavy metals, and the Monsanto connection there to glyphosate is a big one, massive. We are seeing huge effects. And touching on the stress thing one more time, there are studies right now that show that we can alter our microbiome in a good way or a bad way in 24 hours following a stressful event.
Wow.
And so if somebody's going through stress every day, they're going to a job that they don't love, they've got, relationship work, whatever it is, financial worries, whatever it is for somebody, if that's happening day in, day out, you're impacting the status of your microbiome, which has a role to play with keeping those cells really functioning well in your gut. Those are some of the biggest ones, and there are other food sensitivities as well, but gluten is a massive one.
Okay. That's absolutely fascinating. So we have cleaning up the diet, which sounds like in the John Dempster textbook, that's going to be one of the main things that somebody with an autoimmune condition brings to the table, as far as they're going to have some digestive problems. They're going to have some dietary issues, most likely, that they can improve upon. Like you said, it doesn't need to be a radical change, but just making a few changes to lessen the amount of allostatic load or total stressors coming into the body can make a significant difference in these people. One thing that I'd like you to touch on, John, is what you talked about earlier with those 10 different RA patients coming in and 10 different situations that are leading to that condition, and as well as 10 different presentations of rheumatoid arthritis. They're not all the same. But one thing that it's important that I think that all these people with autoimmune conditions need to hear is that just because they've been diagnosed with a certain autoimmune condition does not necessarily mean that they need to be miserable for the rest of their lives or even expressing symptoms. Is that fair to say?
Absolutely. Each time we're working with somebody who's been given a diagnosis, we look at that person as somebody who's been given that label. We don't just look at the label. And we really need to understand, okay, if you've been given this diagnosis, again, of let's say our rheumatoid arthritis, we now need this. That's when the real work begins. We need to peel it back. Not everybody's going to have the same degree of joint pain. Many of my patients come to me and they're like, yeah, I just want to check up. And we find out that their ANA is high or the rheumatoid factor is high or something like this. And we're like, wow. So something's in the weeds here and something's in the works. We may have got this ahead of time, which is great, but you also may be somebody who's not presenting the same way as a typical rheumatoid arthritis case. So this is really where the art of medicine, specifically functional medicine, is so powerful. We've got to make sure that we're looking at the underlying issues, that we're not just focusing on palliating or suppressing any of the symptoms that are being presented, but we also want to get a full understanding of where those imbalances are. And I do think it's important for some people to have that label, like to say, okay, now I have an answer. But in some situations, that label isn't always correct either. And we still need to be understanding and aware enough and open-minded enough to say, look, let's just figure out as much as we can what's going on to lead to these symptoms for you, whatever those symptoms are. You may just be having brain fog. You may just be having, a small degree of joint pain. But some of my RA patients, they can't even get out of bed. They're in so much pain, as I know you've seen probably, many times over. So we've got to really, again, meet them where they're at and really treat them and link arms with them as an individual, as opposed to just saying, okay, you fall under this classification of a diagnosis. We're just going to treat that diagnosis.
Mm-hmm. Well, that's extremely well said, John. And I love your approach because, like you explained, what brought you into this in the first place. There's the science of medicine, and then there's the art of medicine. And it sounds like you're doing a really good job of matching up the two. I love the example that you gave about gluten and how you can test for some of it, but you're aware that there's other things that you can't test for, which means, guess what? Even when you have your blood tests or your hair analysis or your stool analysis, you still need to be matching it up with talking to that patient and determining the clinical presentation. And then you match everything up with the therapies that you give to make sure that you're headed in the right direction.
We still have to look at every patient from a logical perspective and a common sense perspective. Lab tests, as powerful as they are, they're just one tool. That's right. And they're just one part of the toolkit that we use to uncover, to unload on and help out our patients. So we don't let that dictate everything all by itself either. Those are just all little clues that help us put the jigsaw puzzle together.
Mm-hmm. And as part of what you guys do at the Dempster Clinic with patient empowerment, like you talked about, a lot of that comes down to education. Now, I know that you offer an online course that can help people with these types of problems to start understanding what's contributing to their problem and helping themselves right from from the get-go, from the comfort of their own home, without necessarily having to be local to you up in Ontario. So can you tell us a little bit about what's available for your online program?
Well, thank you. Yeah, I created something called the Healthy Gut Institute, and it's just for that reason. It's to help people who don't have access to come in and see us and work with us one-on-one. And it's based on what I call my HEAL methodology. And so we are giving patients, from the comfort of their own home, hours of video footage, dozens of downloadable assets to really just create the foundation of an optimal healing environment, which in my opinion begins in the gut. And so if we can establish that and create a better space for them to start to heal, then that gives us the platform and the way to step off into any direction we need to go. So a lot of our patients, they'll do these principles even before they come in to see us, and then we start to take off from there and do any specific testing that we may need to on one-on-one care. But there's so much that we can do, and those are the things that I'm really trying to share to people who can't work with us one-on-one.
Mm-hmm. Yeah. The most powerful change that a person can make is increasing their own level of awareness and understanding with what's going on with their condition. And then they can start to make those different choices, which, as you said early on, different choices leads to different outcomes. So other things that you're doing at the Dempster Clinic, you guys offer telemedicine also, is that correct, for people that aren't local to you?
We do, yeah. We're in Ontario, and if you are in the province of Ontario, which is a bit of a sticky point in our province, but you have to be within our province to do telemedicine, which is interesting.
Oh, really?
But we do offer that for our patients who are close. Prior to this past year, prior to COVID, we had patients coming in from 40 different countries. So that will start to change again, and I'm optimistic that the doors will start to open on our borders soon. But we do accept patients if they are able to come to the clinic right now.
Okay, so for those of you that are local in Ontario, the Dempster Clinic, and one more time, John, if you could mention the name of your online course.
It's called the Healthy Gut Institute, and you'll find that on our website under the Dempster Clinic. There'll be a big bar that you can find that very easily. But we've got lots of free downloadable videos and assets on our website too, so feel free to take advantage of those. And it's all about our own journey and our own discovery, and everyone's on their own pace. So we've got things for everybody.
Well, I love that you're there and kind of being a guide and helping people head in the right direction as they're on their own path. And your website is thedempsterclinic.com, correct?
Correct.
And I'm going to include a link for the Dempster Clinic in the description down below this video. So for those of you that have interest and want to find out more about what Dr. John Dempster is doing up there at the Dempster Clinic or the Healthy Gut Institute, check the link in the description down below. Thank you so much, Dr. Dempster, for being here. I really appreciate your time.
Thanks, Yoni. It's been a pleasure.
Thank you so much for watching. I really hope that you enjoyed this video and that you'll put the information to good use. Make sure to like the video, comment down below, and subscribe to the channel to stay updated on the new videos that come out each week. If you want to find out more about what Dr. Dempster and his team are doing up in Ontario, check the link in the description down below for the Dempster Clinic. That's all for now. See you next week.